My name is Dr. Ashok Seth, and I'm the chairman of the Fortis Escorts Heart Institute in New Delhi, India. So nearly 40% of the patients who undergo angioplasty in our country, or bypass for that matter, nearly 40–45% are diabetics. And it has been clearly demonstrated that diabetics have a higher recurrence of blockages, higher rates of restenosis after stent implantation compared to non-diabetics. They also have diffuse disease, they also have long blockages, they have multi-vessel disease, and they have calcified lesions. So in all, diabetes forms an important substrate, but not just important, a very difficult set of problems to treat. And it therefore becomes very important for us not just to choose the right technique, but also choose the right device, the right stent, which will give them the best acute results and the best long-term results, especially in terms of restenosis and in terms of survival as well. It has been shown that with the first generation of stents, diabetics actually fared worse, even in survival, compared to non-diabetics having stent implantation. I think it's utmost important that the quality of life-saving devices are the utmost priority. We just don't want safety issues, we want efficacy, and we want to save lives. So whatever we do at this stage for our patients, especially diabetics, should not just get them out of the hospital with safety, but also should be effective in the long term, both in terms of their outcomes and survival. So when we look at that, it becomes utmost that we use the best quality of devices, especially the ones with evidence, especially the ones on whom trials, large randomized trials have been done. Because as we know, the endothelium, the diabetics, the reason they have a higher chances of recurrence, the reasons that they're more prone to heart attacks or have impaired survival in the long term with stent is that the reaction of their endothelium to the stent wall, the inflammatory responses are all altered to the extent that there's a higher rates of restenosis and thrombosis. So we're therefore looking at choosing the best devices for our patients with the best of the evidences. We therefore are also in the processes of not just talking about the present stents, but we're also looking in the future for different stents which are designed for treatment of diabetic patients. It's very important to understand these meta-analysis, which is done as a review of a number of publications pulled together on a specified, pre-specified basis and format, and with pre-specified, we'll restart that. It's very important to understand the data thoroughly. It's important to, these meta-analyses become very important in a way to differentiate between large number of stents studied in a variety of trials. The meta-analysis therefore helps us certainly to decide about which stents would benefit diabetic patients. And yes, it seems that in most meta-analysis and in some of the major randomized trials, Everolimus-Eluting Stent has shown to be superior to other stents in treatment of diabetic patients, both in terms of restenosis and in terms of altering their outcomes. It's interesting that one of the largest studies on diabetics, and as you know, India is the hub of diabetes, one of the largest studies of stent implantation in diabetics was done in India, the Tuxedo study of nearly 2,000 patients with randomization of Everolimus-Eluting Stent to paclitaxel-eluting stent, which at the time of the study, the paclitaxel-eluting stent was thought to provide benefit to diabetic patients more than other stents. It was shown that the Everolimus-Eluting Stent was both far superior in terms of restenosis, in terms of preventing myocardial infarction, in terms of survival, as compared to the other stent. So we are looking at a situation where certainly in the present times, the Everolimus-Eluting Stent stands as superior to most other stents for treatment of diabetic patients, and therefore that becomes a very important point for treatment of our patients in India. I think that it's very important to be evidence-based. It's always thought of in a manner that if you were a diabetic, which is if I was a diabetic, and I had a lesion to be treated, what stent would I actually use on the present evidence? And that is the best way to sieve out the evidence as it stands today. There's no doubt that we need to work harder at getting all the evidence which exists, both in every manner, animal data, human data, so that we can actually look forwards as to redefining and redesigning new stents, especially in India, which are specifically meant for diabetics, which could be suitable for diabetics, which could perhaps have a different method of coating the stents itself, which could perhaps have a different drug on it, perhaps have a double dose drug on it, perhaps have a better coating in a manner that drug can be delivered to the endothelium in diabetic patients. So there's a lot more work to do, but as at the moment it stands, luckily we have an Everolimus-Eluting Stent, which seems to work well in the diabetics, and we can get better at it as we go along. I would also comment very strongly that what we can add on to just stent implantation is also optimization. The stents need to be implanted in a manner that we get the best results and the largest lumens with full apposition of the stent. And that prevents further complication rates both under acute terms and gives us the best long-term outcome. And therefore, as we look for better solutions for diabetic patients, our results should be optimized through intravascular imaging. And it's already been shown that if we do that, we further improve outcomes of our diabetic patients. So let's work at all prongs to give the best to our diabetic patients.